We researched the opioid epidemic.
Hi, I'm Jesse Velasco, and I research the legal lens.
Hi, my name is Claire McFadden, and I research the historical lens.
Hi, I'm Riley McGonigal, and I research the scientific lens.
And I'm Katie Schroeder, and I research the social lens.
Imagine having a simple cough, but instead of letting it pass, one resorts to heroin as a suppressor. As crazy as this sounds, this actually happened in the late 19th century, due to a lack of medical and scientific knowledge. As time progressed, though, doctors and professionals began to understand the addictive natures of opioids, including heroin. Opioids are a type of drug that binds receptor cells to reduce pain, as well as activate the reward regions in the brain, leading to a euphoric feeling, or more commonly known as a high.
In a country where doctors prescribe high-dosage painkillers for mild aches and pains, high rates of addiction should not be seen as a surprise. Addiction has spiraled completely out of control, with 26 to 36 million people abusing opioids worldwide. Opioids have been used for centuries to treat pain, but due to the recent increase in overdose deaths, American society is beginning to reconsider this form of treatment.
In order to understand how to combat this issue, the question, how have the practices concerning prescription opioids contributed to the opioid epidemic, must be answered first. In doing so, we analyze the practices of pharmaceutical companies, physicians, and patients. Considering the historical, social, legal, and scientific implications within each stakeholder helped us to understand how each influenced the epidemic, and this, in turn, led us to our solution. By increasing regulations that limit pharmaceutical company power, synchronizing physicians under the Center for Disease Control guidelines, and exploring other pain management options for patients, the number of deaths due to opioid overdose will decrease dramatically.
Pharmaceutical companies, they have a major influence on the widespread distribution of opioids. If you look at the progression of opioid usage throughout history, it has become clear that the real epidemic didn't start until there became a surplus of opioids available to the public. This was directly related to pharmaceutical companies and their aggressive marketing strategies regarding opioids. For example, Purdue Pharma, a pharmaceutical company, gave physicians a 30-day free trial without disclosing any of the addictive natures of the opioid.
Purdue Pharma's lack of disclosure led these physicians to prescribe opioids to treat pain relatively loosely. Prescriptions for their new drug, OxyContin, increased from 670,000 prescriptions to more than 6 million between the years of 1996 and 2002. Obviously, withholding this information about their addictive qualities should have legal consequences, and it did. They were fined $600 million for lying about their addiction rates, but it didn't make a difference for the pharmaceutical company, since they were already making billions of dollars from their operation.
Similar to the legal lens, Purdue Pharmaceutical was not the only company that put their own economic benefit over the safety of their consumers. The Pain and Policies Group of the University of Wisconsin accepted a $2.5 million bribe in exchange for promoting opioids and supporting weaker regulations. The methods pharmaceutical companies use create a surplus of opioids, which in turn leads to dependence of consumers. As clearly shown through these examples, regulations must be added to limit the power of pharmaceutical companies.
Throughout history, doctors have faced the decision of whether or not to prescribe opioids to both chronic pain and non-chronic pain patients. The prescription of opioids in non-cancer patients became so widespread in the 1990s. It became so widespread that physicians were criticized for being opioid-phobic for not prescribing opioids. This criticism effectively solved the issue of underprescription, but in turn led physicians to overprescribe.
Let's look at the scientific benefits and risks that doctors must weigh before prescribing opioids. On the one side, it is the physician's job to treat pain, and undertreated pain is a serious issue in the United States, with 25 million Americans currently living in chronic pain. Opioids are a very effective solution to this issue, but on the other side, physicians have to be extremely cautious because of the addictive nature of opioids.
Viewing the issue through the social lens, doctors' education concerning the opioid epidemic is crucial. As shown in the map, there are 259 million prescriptions written. The states in dark purple have more prescriptions written than people. Overprescription is caused by a lack of knowledge. Janet Curry of Princeton University found that if every doctor prescribed the way those from top medical schools do, there would be 57% fewer prescriptions and therefore 9% fewer opioid-related deaths. It is evident through all the lenses that there must be a consensus among physicians on appropriate cases to prescribe opioids.
Obviously, patients are a major stakeholder in the debate over whether prescription opioids should be used. They are the ones receiving opioids to help manage their pain. Looking at the progression of opioids throughout history, it has become evident that even though prescriptions were used, they also increased the quality of life for many patients who were using them. But this in turn led to those patients to advocate for more widespread use of prescription opioids. This advocacy allowed patients to begin to pressure physicians into prescribing them opioids to help better the relief of their pain. And then reported overdose deaths increased from more than 10,000 from 1999 to 2008.
Opioids became a social issue because the media fueled interest in opioids, and many patients experiencing mild pain pursued opioids because they solved discomfort much more quickly. According to Sam Kunos, the author of Dreamland, opioids became normalized due to a study by Jane Porter and Herschel Jitt called Pain. This paper was a report on hospitalized patients with no prior addiction history who were given tiny doses of opioids in a controlled environment to treat cancer pain. The media misinterpreted the study, making claims such as addiction rare in patients treated with narcotics.
Now let's look at the scientific benefits of opioid prescription for patients. A medical research report conducted by Cochrane, considered the gold standard for basing medical practice on evidence, concluded that fewer than 1% of patients without prior addiction get hooked on opioids. This would suggest that pain patients are not the ones that are becoming addicted if they are properly screened. Furthermore, it would suggest that opioids do have the potential to be used safely and effectively to substantially better patient lives.
From a legal standpoint, typically opioid users become addicted because they rely solely on the credibility of the doctors in American society. These physicians are legally required to disclose all risks associated with the opioid prescription they are giving, but many times this does not occur. As shown by these lenses, opioid treatment is not always the safest option for patients, and therefore they should seek alternative pain management treatments.
While trying to answer the question, how have the practices concerning prescription opioids contributed to the opioid epidemic, we discovered that it was imperative to research the major different influencers. Through our research, we were able to recognize the practices of pharmaceutical companies, doctors, and patients that led to an increase in opioid overdose deaths. After recognizing these issues, we determined 3 solutions.
Our solution to pharmaceutical companies' aggressive marketing styles is simple. Stricter regulations that require these companies to be completely open concerning the risks of their products must be implemented. Although we do support our solution, sometimes regulations are ineffective because these companies have such a strong hold on the industry. Despite these limitations, regulations are extremely necessary to keep the public safe.
Physicians have also contributed to the opioid epidemic because of their lack of consensus on when or when not opioids should be prescribed. Physicians should follow the guidelines presented by the Center for Disease Control that recommends that non-opioid therapy be the first course of treatment. Also, the lowest effective dose should be prescribed, and patient history should be considered at the highest importance. Although these physicians argue that guidelines restrict opioid prescription too much, it is our recommendation that these guidelines will allow doctors to manage their pain better while keeping them at lower risks for addiction.
Along with issues involving pharmaceutical companies and physicians, there have been multiple cases of patients relying too heavily on opioids without exploring other treatment options. In order to tackle the issue of patients pressuring doctors into prescribing them opioids, doctors must present other treatment options for pain management. Some of these include physical therapy, acupuncture, and chiropractic. Secondly, health insurance companies must alter their policies to cover these alternative options, as patients currently seek opioid treatment because it is one of the only pain management techniques covered by insurance. Although a limitation of this is that these 3 methods do not treat pain as aggressively, they are not addictive, making them the better solution.
These solutions and restrictions will help to decrease the abuse of opioids and therefore lower the death rates that have plagued our nation for decades. And our picture sources, information sources. Thank you.